Good morning. My topic of presentation, my journal presentation is renin angiotensin aldosterone system inhibitors and the risk of COVID-19. My moderator is Dr. Muralidhar sir. Coming to the introduction, severe acute respiratory syndrome coronavirus 2 or SARS-CoV-2 is a virus that causes coronavirus disease in 2019, and it can infect the host cells by means of interaction with the membrane-bound angiotensin converting enzyme 2 ACE2 on the respiratory epithelium. So using the spike-like protein on its surface, the virus binds to the ACE inhibitors. It is also called the S protein. So like a key being inserted into the lock prior to the entry to the infection cells. Hence, ACE2 acts as a cellular doorway or a receptor for the virus that causes COVID-19. ACE2 is a part of the renin-angiotensin aldosterone system and its neurohormonal pathway. So treatment with the Raas inhibitors can increase the tissue expression of ACE2 and its presentation at the cell surface. ACE2 is present in many cells and tissues including lungs, heart, blood vessels, kidneys, livers, gastrointestinal tract. It is also present in the epithelial cells which line certain tissues and create protective barriers. So for this reason, it has been suggested that treatment with ACE inhibitors or angiotensin receptor blockers might increase the risk of COVID-19 after exposure to the SARS-CoV virus. The observation that hypertension may be associated with increased risk of death among the COVID tested positive has also led to the study. Research objective and methodology. It's an observational study, and all the patients in New York University Langone Health electronic health record who had COVID-19 test results recorded from March 1 to April 15, 2020 were included, and also other commercial laboratory tested patients tested in local laboratories and those tested in the New York City or State Department of Health were also included in the study. From the tested patients, we calculate the percentage of patients who were positive and who were negative, and overall patients who had history of hypertension were also recorded. So among the patients with a positive COVID-19 test result, those with severe COVID-19 was defined as admission to the intensive care unit or use of invasive or non-invasive mechanical ventilation or death. And the percentage of patients who met these and did not meet were categorized accordingly. Results. As of April 2020, April 15, 2020, a total of 12,594 were tested for COVID-19, and among these patients 5,894, that is 46.8%, had a positive test result and 6,700 had a negative test result. And also among the 5,894 patients with a positive test, 1,002 had severe COVID as indicated by ICU admission. It included 726 patients, mechanical ventilation that included 311, and death it included 477 patients. So this shows out of total 17,036 patients were tested, but reports were available for only 12,594 patients. Of this, 46% were positive and 17% had severe illness. And also from the total tested positive patients, 4,357 had hypertension, 2,573 were positive of them, and 634 patients had ICU admissions. So again, the patients were divided on the basis of age, sex, then other comorbidities, smoking history, other comorbidities like heart failure, myocardial infarction, then depending on the medication also. So from the study, we noted that there is no absolute difference. That is, there is no difference of at least 10% points in the likelihood of a patient being positive due to ACE inhibitors. This shows the likelihood of positive test in patients with hypertension. So here COVID-19 patients treated with medication, and this is hypertensive patients not treated with medication. In the category of AC inhibitors, almost 584 had the disease, and 583 patients who were not treated with AC inhibitors had the disease. So that makes a mean difference of 0.1, less than minus 4.3 to 4.5. Also in other groups also there was no significant difference in those patients who were treated and who were not treated with antihypertensives. So among the 2,573 patients who had hypertension and positive on testing, 634 had severe illness as indicated by the criteria. So from the study, a substantial difference of greater than 10 percentage points in the likelihood of severe illness was ruled out, with an at least 97.5 certainty for all the medication classes. There was a slightly higher likelihood of severe illness associated with the previous use of calcium channel blockers. This is a likelihood of severe COVID. Again, you can see that AC inhibitors and ARBs do not have a higher incidence. So the patients using AC inhibitors or ARBs do not have a higher incidence of getting severe COVID than the tested patients. Coming to the discussion, in this observational analysis of cohort of more than 12,500 patients who were tested for COVID-19, we come to the conclusion that there was no substantial higher risk, that is marked by a greater than or equal to 10 percentage points of COVID-19 associated with any of the medication studied among the patients with positive test. The data suggested a modestly lower likelihood of positive test for COVID-19 among patients taking beta blocker that was of marginal significance in an analysis. These findings could also be attributed to the effect of beta blocker in the expression or presentation at the cell surface of ACE, the viral receptors for SARS-CoV, or the residual confounding in the observational design. Limitation of the study is that our observation lacked association with beta blockers and the use and the likelihood of severe COVID-19, and also the variation in the diagnostic characteristics for COVID-19 testing method that were used in our cohort study led to the misclassification of COVID-19 status. Thank you.